divided these behaviours into facial markers, body markers, and gait markers. With respect to the facial markers, behaviour 1 is the ears rotated back behind a vertical position for 5 seconds or more. Behaviour 2 is the eyelids being closed or half closed for between 2 and 5 seconds. Staying with the eyes, the sclera being exposed on a repeated basis. You'll observe in many of the photographs that horses often show more than one behaviour. So in the horse on the left, the sclera are exposed in association with a head tilt. The lips are separated, but the teeth are not. An intense stare or glazed expression or looking zoned out, all synonymous terms, for at least 5 seconds. The horse on the left has an intense stare and the mouth is open with separation of the teeth and the tip of the tongue is out. Mouth opening with separation of the teeth or opening and shutting repeatedly for 10 seconds or more. The tongue being exposed, either hanging out on a repeated basis or moving in and out. The bit being pulled through to one side of the horse's mouth. And now the body markers. The head being tilted on one side repeatedly. Repeated changes of head position up and down. The head being in front of a vertical position more than 30 degrees for 10 seconds or more. The head being behind a vertical position more than 10 degrees for 10 seconds or more. The head position changing repeatedly from side to side. The tail being either clamped tightly to the midline, as seen here, or held to one side, a so-called crooked tail. The tail swishing repeatedly. And finally, the gait markers. A rushed gait is defined as a frequency of trot steps of more than 40 per 15 seconds. Included in this definition is an irregular rhythm in trot or canter, or repeated changes of speed in trot or canter. A gait which is too slow is defined as a frequency of trot steps of less than 35 per 15 seconds, which often appears as a passage-like trot. The hind limbs not following the tracks of the forelimbs, but deviated to either the left or the right. So the horse being on at least 3 tracks in trot or in canter. Abnormalities of canter included a repeated strike-off of the wrong leg, or changes in leg in front and or behind, becoming disunited. So in this image, we can see the horse is on the left rein, but it is striking off with the right forelimb leading. These are images depicting the horse becoming disunited or cross-cantering. The horse is in canter right, which was initiated by the trailing left hind limb. In the bottom images, we can see that the right hind limb has become the new trailing hind limb, but there is no change in front. Spontaneous changes of gait. For example, the horse breaking from canter to trot, or from trot to canter, or from trot to walk.